We are employees of the United States Department of Health and Human Services in charge of a project researching how administrative costs are affecting healthcare costs and overall. Asha Howard, the project coordinator, Margaret Clements, the project manager. Why is healthcare cost an issue? It has been proven that cost is one of the three main problems the United States healthcare has, the other two being quality and access. Therefore, healthcare cost is an issue for every American. Healthcare cost grows faster than inflation. Compared to inflation, which means an increase in the price of a basket of goods and services that is representative of the economy as a whole, healthcare cost grows faster. For example, from 1960 to present, healthcare cost has increased from an average of $147 per person to between $7,000 and $8,000 per person. Compared to the United States gross domestic product, healthcare costs grew from 5.2% to 15%. What are the effects of healthcare administrative costs? According to the Institute of Medicine, the amount of time and money spent on administrative tasks is one of the most frustrating aspects of our modern medicine. The United States spends $361 billion each year on healthcare administration, which is equal to 14% of all healthcare expenditures. Administrative costs for private health insurance plans, for example, rose by 117% from 2001 to 2010. During this same period, the total national health expenditures rose only by 74%. We may ask ourselves why healthcare administrative costs increase so much. There are many factors involved in the rise of healthcare administrative costs. The ones we discussed are the third-party involvement and the billing and coding system. What is the negative effect of the third party? Insurance companies and the government being between the patient and the provider, claim submissions are more time-consuming and more expensive. For example, when a medical provider orders an MRI for a patient, the third party may require prior authorization, which requires explanation from the doctor as to why this procedure is medically necessary. This could take several phone calls or faxes, additional wait time for the patient to be diagnosed and treated, and longer processing with risk of more cost. Due to frequent changes, staff in the provider's offices must determine which insurer is covering the patient each month and how much to collect. Billing and coding. According to the Institute of Medicine, the average U.S. physician spends 43 minutes a day interacting with health plans about payment. On top of that, he or she has to hire staff who spend hours and hours translating clinical services into billing codes, submitting claims, and monitoring reimbursements. An example given by a Harvard economist, David Carter, in a PBS interview was how Duke Hospital is a 900-bed facility but employs 1,300 individuals in the coding and billing department only. What is the role of technology in this? There is a lack of well-designed electronic access for filing claims, requesting for prior authorizations, and so on. The worst case is that even the non-well-designed that is in place is not efficiently used because some physician practices and payers do not use computers or do not know how to use them well, which generates excessive administrative costs by spending more time on it or hiring experts to do the job. The other example of technology costs is the lack of standardization among payers for every form of physician-payer interaction, such as the web access portals and claim editing processes, which generate tremendous cost. The other big issue in rise of healthcare costs is malpractice insurance. Medical malpractice access arises when an individual suffers injury or death as a result of a medical professional or hospital's negligence. Increase in liability for medical malpractice raises healthcare spending through higher malpractice insurance premiums and through defensive medicine when doctors attempt to limit their risk of being sued by ordering more tests or procedures than it is necessary. So, what do we get from this information? Do you think the third-party involvement is a necessity? Why or why not? Do you think malpractice insurance is a burden to physicians as a whole? Why or why not? What is defensive medicine and why is it practiced? We at the U.S. Department of Health and Human Services have concluded, according to given facts from research, that administrative costs make the largest factor in the healthcare spending increase over the long run. The number one is the third-party involvement, including time and money spent on claim processing, followed by technology and malpractice insurance. Thank you for your time and your participation.